Welcome to Issues and Answers with Diane Kinderwater. Issues and Answers is presented as a public service to New Mexicans by State Employees Credit Union, who have been proudly serving the families of New Mexico locally and abroad since 1958. State Employees Credit Union is ready to help you and your family with all your financial goals. And now, Issues and Answers with Diane Kinderwater.
Welcome to the program. I'm Diane Kinderwater. Approaching crises in our community in Albuquerque is taking a whole different approach, dealing with such things, urgent matters, dealing with homelessness, mental illness. People who are drunk in the community, perhaps in their homes or out in public, will all be handled differently. Today in the show, we're going to be discussing the Albuquerque Community Safety Department. It's a brand new department. You probably heard in the news, read in the paper, heard on the TV about, oh, we're taking police off the streets. Well, that isn't necessarily the case, and we're going to discuss what this Albuquerque Community Safety Department is and what it is not. So please stay with us as we discuss handling crime and handling safety of our community right after this. Welcome back to the program. I'm really excited to have this show because it was kind of a misunderstanding to me when I read about it in the media. I thought, oh my gosh, I appreciate the police, what they're doing in our community. I know they're there if we need them. Perhaps there are not as many as we need in Albuquerque because we know crime is just escalating in our community. It has been for years, and we're so disappointed about that. So when I read, oh my gosh, we're taking money away from policing and putting it somewhere else, I thought, that doesn't sound good to me. But what does sound good is dealing with mental illness, dealing with people who are homeless in a whole new way, because calling 911 and getting the police there, and I just read the material saying they just bring them to the hospital anyways. Is that a good use of our resources? You're going to have to decide, because you as a taxpayer and we're paying for all this. But I'm so pleased to have the new coordinator for the Albuquerque Community Safety Department in our studios with us in Albuquerque to discuss what is this program and what is not. So Mariela, Ruiz-Angel, thank you so much for being a part of the program.
Thank you so much for having me.
We're so excited to hear. And Mike Kruchowski, he's been on the program before. He's the secretary of the Albuquerque Community Policing Council, the Council of Chairs. So thank you, Mike, actually for introducing Mariela to us.
My pleasure.
And in a nutshell, Mike is going to tell us a little later, and he's been on the show before, from the Southeast area, what the Community Policing Council does. But also, we're going to talk hand in hand how it's going to work with this new coordinator with Mariela. So, Mariela, tell me what it is and what it is not. I know you have a nice little program that told, and I was reading through it. Oh, that's what it is. That makes sense. And it's not really taking police off the street, but just redirecting the help.
Yep. So this is going to be a cabinet level department, so it's not going to coexist in the police department. It's not going to be a part of family and community. It'll be its own department with divisions. So we have big problems and we got to have big solutions. So that's why we went with the department versus a program. It's going to be responding to 911 calls. So when you call 911 for an emergency, the dispatcher will qualify the call to figure out, is this a police officer? Is it a hard crime, right? Is it a fire or something that an EMS needs to go out to, right? To maybe stabilize somebody's vitals, who knows? Or is it a mental behavioral health situation in which we need to bring in a specialist who can assess and understand and evaluate somebody for potentially the next steps? Maybe it's not even in mental health. Maybe it's just a connection to a resource, right? Getting connected.
Because they don't know who else to call.
Yeah,
911, they say, I need help. I need help. I don't have family to help me. I need the police or 911,
I need assistance, right? I need help. And we want to be able to utilize police resources for those violent, hard crimes that we know exist in our city. But mental and behavioral health are not violent, hard crimes. And we know that there is different approaches, innovative approaches for us to be able to handle those calls. And so that's what we want to be able to do, right? Things like inebriation and homelessness, and even just like there's an array of different types of calls, addiction, all kinds. So we're really excited about being able to have this department to be able to assist our fire, to be able to assist our police, assist family and community, and to be partners with our community in trying to really look at this through a systemic way and start to, come together, right?
Because we have the resources out there, it's just they're not getting directed to them.
Yeah, or it's just too hard. Somebody in crises, right? If you think about Maslow's hierarchy, it's like if you can't even figure out how to get shoes or food, what makes us think that we're going to be able to get them jobs, right? Like that's just not something we can do at this moment. We have to get them out of that crisis moment.
Thanks.
So with that said, we're going to be hiring trained professionals such as social workers, community workers, right? We've got violence prevention folks, even our homeless prevention interventionists that we know have been doing this work or are trained to do this work.
Mike, with the, again, the Albuquerque Community Policing Council, there was when it first was introduced, would you agree that the public maybe didn't understand it, that there was some criticism that, oh my gosh, we're not going to have police on the street?
We recognized that immediately, that people were going to think that we're, quote, defunding the police. What we're really looking at is trying to provide support and resources for our officers on the street to make their jobs easier and safer, because this helps the officers a lot better to do the jobs that they want to do, and we ask an awful lot of the officers. I'll leave it at that.
Well, I guess when it all came out of defunding the police, Mike and Mariela, was when we had the Black Lives Matter and we had the national attention on Mr. Floyd in Minneapolis and all these other police shootings and abuse of force, and that was all happening. And then all of a sudden we're introducing a new department, and then they were saying, oh my gosh, we're defunding police. Was it just a problem of timing?
There was that problem of timing. I think what we want is that the officers can focus on the more critical things that they do for stopping violent crimes, responding to car accidents, things like that, where we're not taking away from the police department and the officers. We're providing some backup resources for them so that they can focus on other areas.
Has the Community Policing Councils, Mike, discussed this over years of saying we are kind of wasting our police expertise by sending them somewhere where they're just sending the people off to the hospital? Has this been an issue discussed previously by the Community Policing Councils?
In some respects, we have had presentations from a lot of the agencies that have provided support for, family, domestic disputes, addiction, mental health issues, and so forth. We've had presentations about it. We've also experienced it on our ride-alongs when we go out with the officers.
And what did you see? What did you see? Why are we here? Right?
Well, because there was nobody else that people could call. I wanted to touch on something that, when we talk about resources, a lot of the homeless people, I talk to them every day. I go out and bike the alleys, the parks, and so forth. They are often not even aware that there are places like the New Mexico Coalition to End Homelessness. A fantastic program, organization. They're not aware of it, and they have no way to get in touch with it, and they have no way to get information from them unless they push their cart right up the street to knock on the door at the office. So
they don't know.
Just having the knowledge, awareness of it, and an ability to reach out. I've seen the...
But I imagine these organizations are going around, as you are, going into the public and seeing the homelessness as you are, so they must be contacting outreach. It's called outreach, right, Mariela?
We have really great street outreach.
They've got to be doing that.
And I will say, I think what we're talking about is sometimes the bigger system, right? Unfortunately, we're not a city that has a large enough detox center, nor do we have, or sobering center, and we don't have a triage center. So, and those are very costly, large types of needs that we have for our community. Unfortunately, ACS will probably have will be hit with that same challenge, right? Do we get to a scene, somebody needs medical attention, maybe doesn't need medical attention, but the only place that we can sometimes take them is the hospital or to jail. And we're not going to take them to jail. So at the end of the day, unfortunately, unless we have that third place to take them, again, more beds, more people to be able to help with that wraparound services, we're going to end up having we're still going to get hit with that same hardship. Now, do we think that this new department can potentially get them in contact with those providers a little better, right? To say, let us follow up, we'll connect you to that person. They will come to you, right? You don't have to take your cart to the West Side shelter. Like, let's figure out how to get your cart to the West Side shelter. So it's really coming up with ways to work with community versus, you know, here's a pamphlet, good luck, you should call one of these places when they don't have a phone.
Actually, I had a friend who was mentally ill, which she knew she was, and I work state government, and I said, here, I gave her the numbers. These are all the numbers you can call. And I thought, that was a great service I gave her. But what I didn't realize, that when she was mentally ill, she couldn't pick up the phone to call. I mean, she was in a severe depression, which hit me like, oh, they really can't even do that.
Yep.
So I understand. So thank you, Mariela, really for all of this. What I'd like to touch upon is what we do now and what we're going to do in the future. And I think it's going to start in January, February. The material that you sent me was very interesting. We have, and I'm just going to speak roughly, I'm not sure, we have Albuquerque Fire Department, about 16,000 calls. I'm not sure if this was a year or a month or a day
a month.
A month.
Yeah.
Okay. APD was 1,374. So all these calls go to 911, and out of all that, it costs maybe $94 to send the fire department a day. APD about $84 an hour to send APD. So we get down to this basically, 18,000 calls to 911 in a month. They don't result in any, like, I think there were 19 arrests, but most of them sent everybody to the emergency room. So this just means the police and fire handling a lot of these calls weren't necessary for the police or fire to handle, because I'm not saying pass it off, but they sent them to where they were needed and not police or fire. That's a lot of money.
Yeah.
The number was, I think, thousands of dollars when police weren't needed in the fire. The big fire truck wasn't needed to be sent out, or the EMS. Other people could be handling these situations.
Specialists, people who are truly have years of education and experience in doing this work. I mean, it's not, we can't expect for police to be everything. We can't expect for EMS and fire to be everything, right? I mean, we hope for that, but I was just at a scene a while back, and it was a woman who'd overdosed, and we see this often where they don't want to go to the hospital because that's kind of their day-to-day. Sometimes they overdose and you're able to revive them, but they're not going to quit, so they're not going to go to the hospital and potentially get put through a psych evaluation, then be released when they realize that they're not going to take the help. And so we got to the scene, and the AMS came in and did what they needed to do, revive the woman, and then they left, and I was left there watching the family of the victim who had called 911, who was like, now what do I do, right? What am I supposed to do with my daughter who's in crisis and in problems, and I don't know how to help her.
Call again. I guess they do, call again, 911.
And so that's the reality. And so how do we start to have those conversations about even just how to be proactive next time? What do we do next time, right? How do you take care of yourself in a situation like this? Lots of us in New Mexico and across the United States, right, there is an epidemic of drug and alcohol abuse. A lot of us have family members or friends. And so how do we start to talk about that with community, with families who are having to deal with that in their own homes?
So how will this work? Meaning a family doesn't know what to do, they call 911. Let's take the accidental overdose, and perhaps someone being bothered, three cases. Somebody being bothered by a homeless person. They say, they're in my community, I don't want them here. And what with mental illness, what's the case?
We can even do like
suicide.
a suicide. Sure.
Okay, those are the three issues. We know how they're kind of handled now. Police are sent out.
Yep, police or EMS, right? So for drug overdose, EMS and fire will go out. And they will bring that person back, and either they go to the hospital and take that person if they choose, or
that's it. They don't take. They
don't have the time.
It's not against the law to overdose, and it's not against the law to be mentally ill.
No.
Okay. So the case of a person, or their family member is scared that they're going to be committing suicide. They don't have any weapons, but
they're not
just
armed.
acting erratically. They're not armed. They call 911. The family member says, my son is acting erratically. I'm afraid.
Yep.
Of course, there have been horrible cases here in Albuquerque and across the country when police haven't necessarily handled it correctly.
Or that it escalates quickly. And the reality is that sometimes that is a trigger for people, right? For people who are mentally ill. Do they want to get in a police car in the middle of an episode where they are just like, we don't want to criminalize them, right? And so right now, sometimes the ambulance will come out and transfer them. And so the reality is, though, a lot of these cases we have seen where people just need to we just need a little bit more time, which we know police don't have. And we need to be able to sit and discuss, hey, let's have a conversation about what's really going on.
So what
right?
will happen starting in January, February next year, 2021, maybe when this program is even airing?
Sure.
What will happen with that call? The family member, with the erratic family member, son, father, husband, will mother, daughter, not just man, will call 911. How will it be different?
So it will be different in the sense that instead of the police going, depending on how escalated it is, right? So if it's a situation where maybe
they're just in the street ranting and screaming.
Yeah, or someone's about to jump off a bridge. Like that's a big one. Those happen. We will have to send the right person. So we have mobile crisis teams. If we absolutely need police to be there, we will do a co-response. But many of these calls are ideation and not even full attempt. And so we think that if we can go out to those calls, and then again, if we need backup, thank God we do have the police to say, hey, this is a situation where someone is armed, and
but let's say with the person who is not armed.
Yeah.
They're in their neighborhood, they're not going to jump off a bridge, but they're just screaming, the family needs help.
We will send out
So they're not going to send out police.
Nope.
As they would today. In 2020, they would be sending police out.
Nope. We will send out an ACS responder who can
go
out. Well, an Albuquerque Community Safety responder who will go out, and this person, again, will have experience in doing this kind of stuff. De-escalation, stabilization, and be able to get that person to the right resource. It may not even be a need for it, right? It could be a soft transfer to say, clearly this person might be dealing with depression and maybe is off their meds, and we just need to get them, and maybe their parents can take them to the
And these people will not be
hospital.
armed, correct?
No, they will not be armed.
So sometimes it's a little bit of relief for a family saying, because we've had cases where mentally ill people have been shot and killed by police. That's why we've had the federal government come in here, Department of Justice. And just recently there have been articles on how policing the police hasn't been very good. That's according to the Monitor on that recently. What is your feeling for our community that people other than armed police officers will be able to go and de-escalate crises without weapons?
It's a great step forward, in my opinion. Having done some crisis intervention and suicide prevention work myself, I see really wonderful things happening in Albuquerque. I liked one, I'm stepping off the issue here a second, but the co-response, that's where the CPCs are likely to be most engaged in the policies that are going to have to be written about who to dispatch. You know, the call comes in, and does it go to APD, ACS, or is it a co-response? And so we're going to probably be engaged in evaluating and making recommendations on the SOPs, the standard operating procedures, and the training required. That's our engagement into this process. Well, what's my feeling about this? Like I said, I ride the streets every morning. I talk to homeless people. There's some really honest people. They care for one another and watch out for one another. They're not aware of some of the resources that are available. I try to scribble notes down but I've witnessed in one particular case that I've been involved with for 6 months now. I've witnessed a care provider, a crisis worker go out to a park and talk to a homeless woman there where she was camped out. And it starts the ball rolling. And that's what we need, is to get the ball rolling in the long process.
So we didn't deal, Mariela, with the homeless. We dealt with the suicide, the drug prevention. So a homeless situation, let's say a neighbor is bothered by the homeless person and says they're acting erratically. What will happen in the future with the 911 call? They'll decide to send out.
Well, similarly, I think it depends on the situation. I mean, if it's person is having, you said maybe erratic, right? Erratic behavior, and maybe he's homeless. Who knows? If the person, we haven't even gotten in contact with them, and the neighbor doesn't really know him, who knows? Maybe he's just off his medication. For all, it could be our grandmother who has dementia. So I think it could be a possibility for us to go out to those calls, and then again.
And then who? The Albuquerque
Albuquerque Community Safety Department would go out, observe, watch, see what's going on, try to de-escalate.
Is this like a psychologist, or what? When
No,
you say
we'll
just
have-
a member, what
So
kind
we'll
of
have
background will they have?
multiple people. I mean, our mobile crisis team will have clinicians who will be able to understand some of the diagnoses that we'll be dealing with.
So it's the mobile crisis team.
And that will also potentially, that is actually coming over to the Albuquerque Community Safety Department, and will work in co-response with police. And again, those clinicians take on much higher acuity types of calls. We'll still take on some of those higher acuity calls with other types of social workers or clinicians, but we'll have both. I think we'll even have peer support workers, right? Peer support workers sometimes are the best people to send out to things like people who are dealing with addiction, right? Especially after they've already come off of it and might be dealing with the after effects, which sometimes makes them erratic.
Mariela, are other cities doing this?
Yes, I actually I've been talking to Chicago, which is one of the largest cities in the nation, and they have been really working hard to try to get something like this even just planned and going. And so it's this is not an easy thing, right? If it was, we would have done it years ago. Right? So the reality is that it does take planning. It does take finding the right people. It does take finding the right types of calls. We don't want to put anybody in danger. We don't want to put ourselves in danger. So the reality is it takes a lot of planning. You have to work with community, right? There's a lot of mistrust between community and the city in general across the nation. And so we have to start figuring out, how do we build trust? How do we start to do this together? And let's, because one slip up, whether it be Albuquerque, Chicago, Sacramento, that'll be the end of this. It could potentially, right? It could then say, this doesn't work. And that's not what we want to go. We want this to work. It just has to be done very meticulously and purposeful.
I think that the public knew, again, those figures that you had provided me for the month, that we're sending out the ER or the police department and the fire department to all these calls where they don't need their expertise doesn't need to necessarily be there, but other expertise is needed.
Yeah, no, I mean, you had some great stats, Mike. I don't know if you were sharing them earlier with me.
Those were just on the monthly crime reports. You wanted to
Oh no, we're going to talk another show on that. I had that.
No, that's why I said I want this.
But there was some interest, even in the crime reports. A big chunk of those, 10 to 20% of those, are not criminal. We don't need to take them to jail. So why do we need to send police if it's not necessary? It saves us money. It saves them time.
At $84 an hour.
Yeah.
I was like, oh, taxpayers are paying for this. Again, fired $94 for each trip they send out their vehicle.
And again, it allows us, it's just the same way that we would never send a police officer out to maybe an EMS situation, right? We distinguish between our fire department, our police department, our security that we have that does security around the city. Now we have a third response.
But the 911 callers, they're going to have some additional training to figure out, because now they just send out dispatch. They dispatch the police or the fire. Now they'll have to decide to go.
Yeah.
Well, they'll call your department or dispatch.
So our dispatch will have right at this point, as we're working through the types of calls, they themselves will be the ones to be able to say, okay, this is a call, right? This 39.5 or whatever it might be is going to we're going to send it over to ACS, or they'll be the ones to say, we know that this is a violent scene, but we also know that maybe ACS can help in the aftermath. So let's send APD first, and then we'll send an ACS responder after.
And with the aftermath, tell me how that's going to work in terms of the homeless, the mentally ill. You will be charged with giving them social service programs.
We will
and
be
following up as well.
Following up, being proactive, right, doing that preventative work. We actually just did a survey, and it's been out for probably about 6 months almost. But one of the big things, and I didn't memorize it, but one of the big things that people felt were really important about this role for this new department is to connect people to homeless services, drug treatment, needle exchange and prevention, and to really do that preventative work and to do that outreach. So do we think that we're going to go out to 911 calls? Yes. Do we think that we're also going to be out in the streets and I see somebody who's not wearing shoes and pants and I can pull over and say, hey, I think you might need pants and shoes. Let's talk about this, right? Can we do all of that? We should be able to.
So it won't be just Mike Krachowski with a little piece of paper handed to hopeless people saying, do this. I mean, and we appreciate your efforts, but you see that this whole department will have this charge, will be responsible for this.
Yeah.
And again, the follow-up.
Yes, the follow-up. And the big thing is we're not doing intensive care management. We have programs that do that. Nonprofits and hospitals and folks that do that work very well. We're just going to become a connector. So it'll be our responsibility more than anything to get these folks to the right help that they need for their long-term, whether it be sobriety, right, evaluations, and long-term recovery that we know that they need.
Mariela, thank you so much.
Do we have time? Just, you know.
We don't. Next show, we don't.
Next show, that's fine.
And he's been a tremendous resource, and we appreciate it. And the audience will say, well, what did Mike want to say? We got 10 seconds, Mike. Can you say it in 10?
I can't remember now.
Oh, no, sorry. Mike Krachowski, thank you. He's the Secretary of Albuquerque's Community Policing Council of Chairs. Thanks for all you're doing for the community and here at KCHF TV for introducing us to these programs. Again, many of us didn't even know they existed. We didn't. We know
so
we
happy
need
I
help
could
there.
be here.
And Mariela Ruiz-Angel, again, is the coordinator. And any last points you'd like to share?
No, stay tuned. Be patient. This is a new thing. All cities are having to kind of figure this out, but know that we will have more information and a bigger campaign coming into the new year.
And you'll be back.
We'll be back.
Thank you. Thank you for watching the program. I'm Diane Kinderwater. Make it a great week with your family. We will see you next time. And again, hopefully good things for the future for Albuquerque. Bye-bye.
Issues and Answers with Diane Kinderwater is presented as a public service to New Mexicans by State Employees Credit Union, which has proudly been serving the families in New Mexico locally and abroad since 1958. State Employees Credit Union is ready to help you and your family with all your financial goals and is the exclusive sponsor of Issues and Answers with Diane Kinderwater in order to inform, educate, and better the lives of New Mexicans. To comment on today's program or to purchase a DVD copy of any Issues and Answers program, visit sunbroadcasting.org or call us at 505-345-1991.